It's time for Studio 7, sponsored by your Permian Basin Chevy dealers.
It's the art of dentistry. Dr. Robin Rutherford.
Welcome back. Have you lost any of your teeth? In today's Art of Dentistry, Dr. Robin Rutherford is here to talk about the importance of keeping all of your teeth and what options you have if you do lose any. Dr. Robin Rutherford, thank you for being with us.
Always enjoy it.
Okay, so we're talking about losing teeth today, the importance of trying to keep them. Talk to us about one of the patients you saw recently.
Yeah, well, I was going to say, that people seem to think nothing of losing a tooth, especially if it's in the back. Oh, if that's in the front where it shows, well, people think that's important.
Right.
But if it's in the back, pull it. It's cheaper or whatever, too much trouble,
Right.
Well, and I'm going to show you a patient today that came to see me just this past week.
Wow.
Okay, so this first photo shows a tooth. It was an upper tooth. And you see the little dark line going down the center of the tooth.
Yes.
So this looks like a completely normal tooth until I touch it with my little explorer, we call it,
Right.
and realize that, oh, this half moves independently of the other half. They had split that tooth right down the middle.
Wow.
Now, here's the way it happened. Here's the panoramic x-ray of that patient. Look on our right side and you can see that obviously there's one tooth missing. When teeth chew together, you have to have an upper versus a lower tooth. They're
Right.
a pair.
Right.
And if you lose one tooth, the other tooth now does not chew for you.
Okay.
It just bites against air. So what happens to the other teeth in that section? Well, they have to pick up the slack. You have fewer teeth to do the same job, and so all the teeth have to carry more load than usual. Well, if you look at that upper one, count 1, 2, 3 forward, that's the one that split.
Wow.
Because it was given too much workload to do.
Too much
So
work.
the important thing here is don't lose a tooth in
Right.
the first place. Don't say, oh, it's cheaper, just pull it or whatever, who cares,
Right.
You should want to keep all of your teeth. It's like losing one of your fingers or something, I
Right.
don't care if it would be cheaper.
Right.
Well, and the best way to replace something now, if you do lose it, is with an implant.
Right.
So.
You want to tell us about, you have an example of one more
Yep.
patient, right?
I have a similar case. The next photo is another broken tooth. And the next photo, that's an upper. This one's a lower. Next photo, very similar x-ray. Now this is a different patient, but came in shortly after. And again, missing one tooth on our bottom left there. Now, the other thing that happens, that always happens with people, is when one side now does not chew as well for you, so what do? You switch over to the other side. Even just without thinking about it, you just sort of learn that it chews better. And so you do most of your chewing on the right side in this case. Well, it's the upper right and lower right two teeth that I just showed you that broke off on this gentleman. So again, those two teeth are broken because of having lost the first one. So that split tooth I showed you on the first patient, she is going to lose that tooth, and now she's going to have another implant. She's going to have two teeth that need fixing. This gentleman, with the two broken teeth, now those just needed crowns. They were very fixable. But when you actually split a tooth, maybe it's not fixable.
Right, so the moral of the story is, one, don't lose a tooth, but two, if you do, you've got to get it fixed. You got to replace it.
Right, replace missing teeth. And nowadays with implants, it's very easy. I place implants all the time. I think I placed 7 implants in the last couple of days. But it's not very difficult. Sometimes it takes me as little as 15 minutes to place an implant. And usually people tell me it was a little sore for a day or two,
Right.
like they took a couple of Tylenol or an Advil or something, and that was the extent of it. And so it's simple to do, and we can just give you back a tooth where you need a tooth.
Nothing to be nervous about, too. You can do sedation.
Sedation, sure.
Okay, well,
Yeah.
Dr. Rutherford, thank you so much for being with us.
Great.
It's the art of